The Masters in Demography and Health is Europe's only graduate course in population studies that also emphasises health and social epidemiology. This course is the basis of all population health science because it provides postgraduate training in statistics, epidemiology, research methods, as well as the determinants and consequences of population trends. Demography is a small area of expertise, but actually there aren't many courses, and the ones that do exist actually concentrate mainly on demographic technical methods or population studies in general. This is the only course that actually links with health, social welfare and economic development. It provides students with broad-based skills that can be used in many fields, that can be used in social welfare, economic development, as well as population studies and health.
I chose to study demography and health at the school because my undergrad was in environmental studies, so I wanted to do something of a more social concept. And then when I looked into the master's degree at the school, I thought this was very interesting because it had bits of like epidemiology and statistics, but also there were some courses that were environmentally related. So I thought that this would be very interesting. That's why I applied.
I chose to study demography and health because I'm a geographer. My undergraduate degree is in geography, human geography. And so I was looking for a master's degree that would give me a chance to delve further into a subject that over time I've become more interested in.
This course is designed for people who are interested in acquiring technical demographic skills, but also people who are interested in understanding the linkages between population studies and health issues. For example, aging, sexual behaviour, health inequalities, things like that.
The advantages of the course are after the first term, we get to choose our own courses, like the ones we like more, which is kind of nice because we can tailor our program to like our individual wants and needs. And also because the first semester courses were quite chaotic, it's nice to see that all of those merge together, and at the end of the second semester you have an idea about why you were studying all those first term courses.
So the teaching is very varied. Sometimes you're in a lecture theatre with 200 people, with obviously a lecturer, PowerPoint slides to support the work. And then at times you're in a much smaller group. There's a lot of hands-on work, so a lot of work in computer labs, working with different technology and different programs. Very often the larger lectures are then supported by practicals. So you might be in a lecture theatre with 200 people, but then you will be in a practical with maybe just 8 or 10. And sometimes that could be a discussion group, sometimes that could be a computer exercise, sometimes that will be a seminar, sometimes students are presenting. So it really varies, and that's obviously another real plus about the course.
We get to have the theory in the beginning and then the practicals, which was helping us understand, and we also get to cooperate and ask questions in case we miss something in the theory part. I thought that was quite helpful, and lots of projects, which was good because you get to do your own research and then get feedback on that.
Students who do this course go into 4 broad areas. One is academia, where they can do demographic or health research. The second is students who come from abroad. They may be sent by a ministry or a government organisation. They would then maybe go back to more promoted roles within that organisation. The third is international agencies, so that things like the UN or WHO, things like that. And the fourth is NGOs, Save the Children or International Planned Parenthood.
I highly recommend it because you get a very good in-depth knowledge of demography, which of course is not all of demography, but you've got very good skills that you can then build on. You also integrate that with public health in a way that, for me was a completely new area, but it enriches the demography, and you also understand well how demographers can contribute to public health. So I think it expands the role of demography.
Also, one of my future plans is hopefully to get a publication out of my summer project. So now we're in that phase with my tutor when we're like twisting it around and making a few changes in order to turn it to a more presentable form. So hopefully it will get published in the future.